So today's topic is healthcare services in India. So after the resources, the main elements of healthcare delivery system is healthcare services and healthcare system. So the main element of healthcare delivery system is healthcare services. So the purpose of these healthcare services is to improve the health status of the population. Basically, the healthcare delivery system main goals or objectives or purpose is to improve the health status of the population and to decrease the disease condition. The main goals of healthcare services are to reduce the mortality rate and morbidity rate, to increase the life expectancy, to decrease the population growth of the population, and to improve the nutritional status of the population, etc. So the healthcare system, it constitutes the management sector and involves organizational matters. Mainly healthcare system operates in the context of the socio-economic and political framework of the country. So basically the healthcare system, it is the main it deals with the management sector and organizational sector. So in India, it is represented by five major sectors. So, healthcare systems in India. So, I previously told the healthcare system is basically the organizational setup of health system. So, in organizational setup in India, there is five major sections are present. In healthcare system, there is five major sections. In first section or first sector is public health sector. So healthcare system in India is basically deals with the management and organizational matters. So in India, the healthcare system is represented in five major sectors. Means it constitute with five major sector. The first sector is public health sector. The first sector is public health sector, and the public health sector is further divided into two sectors, that is primary healthcare sector and sub center. Primary healthcare and sub center. And next is the hospitals. So first is public health sector. This public health sector is divided into two sectors, that is primary health sector and sub center. Public health sector is divided into two, primary health care, that is divided into primary health centers and sub center. Next, the public health sector's next division is hospitals. The hospitals is divided into the five major sectors. The hospitals is divided into five major sectors, that is first is community health center, second is rural hospital, third is district hospital, fourth is specialist hospital and teaching hospital. The next hospitals where five levels of healthcare services are given, that is started from community health center. At it is situated at the grassroots level. Means the community health centers. The second division of public health sector is hospital. This hospital is further divided into five sectors. First is community health center. The community health center is dealing with the grassroots levels at the baseline level. The next level is rural hospital. After the community health center, next level is rural hospital. And then next is, after that, next is district hospital. And after the next level, after the district hospital, the next level is specialist hospital. And at the top, that is teaching hospital. So from the base, the hospital is divided into 5 from the base, that is community health centers. And after the next level, that is rural hospital. And after that, district hospital. After that, specialist hospital. And after that, at the top, that is teaching hospital, means the academic national hospitals. So then the third, after the hospitals, in public health sector, the third level, or the third sector is health insurance schemes. The third is health insurance scheme, where two types of schemes are there, that is employee state insurance and central government health scheme. There are two types of schemes are there in health insurance scheme, that is employee state insurance and central government health scheme. And the fourth section or sector is other agency, that is defense and railway agency. So in public health sector, there is first is primary health care, next is hospitals, third is the health insurance, and fourth is other agencies. It is under public health sector. And after that, second is the second healthcare system. Under the healthcare system, the second division is private sector. In private sector, here mainly private hospitals, polyclinics, nursing homes, dispensaries, those are covered under private sector. So in private sector, mainly polyclinics, hospitals, nursing homes, dispensaries, those are covered under private sectors. And in third, that is indigenous system of medicine. In indigenous system of medicine are covered here. Under this indigenous system, Ayurveda, Siddha, Unani, homeopathy are present in this sector. So in indigenous system of medicine, here mainly Ayurveda, homeopathy, Unani, those are comes under indigenous system of medicine. Other than that, voluntary health agencies and national health programs are present to provide various aspects of healthcare services to the community people.